The last year's been one of the most interesting in my 30 plus years in the health service. It was a scary start and we very quickly settled into a sort of new way of working. It's had its challenges, as it has for the whole health service and health and social care. It's been tricky at times, and there's been times more than I have ever had before when I thought, oh, I'm just actually quite tired.
The pandemic has really affected people's mental health. I think people are really anxious. The restrictions, the lockdown has meant that the things that people do that are helpful for their mental health, they haven't been able to access.
The hub itself over the 12 months has taken nearly 12,000 calls from a whole range of different people. And so what we try to do is we try to work individually with people, especially the ones with complex needs, and try and unpick some of their issues. And we couldn't have done that without Virgin Care, the council and the CCG. We couldn't have done it without the community and voluntary sector and the hundreds of volunteers that they provided to support the activities that we were doing.
So before the pandemic started, I was working in musculoskeletal patients. As a result of the COVID pandemic, I've been redeployed to the community team. Many of my physio colleagues were redeployed in the first pandemic when we just didn't know what beast we were facing, and I was asked, oh, you know, you need 5 of your physios to go off to a COVID ward, and I was thinking, I can't make that decision. And they did it. They were incredibly resilient and kept their heads high, and I'm so proud of them for that.
We had to make some really quite significant changes really quite quickly. Face-to-face contact was postponed, but we continued to see people during that, so we moved to the telephone. And then we were able to offer video appointments, and that was really helpful.
It's been difficult not seeing patients so much. That's been really hard. Actually, to provide really good health, you don't need a lot of fancy tech. But also for those patients with longer term conditions who we know about, they are being encouraged and supported to take a much more proactive part in their management of their condition.
When you realise how much inequality sometimes there is on our very own doorstep, which you don't see, and what the pandemic has done is it's brought an awful lot of that into focus. So a lot of people have suddenly appeared, and you suddenly think, crikey. I delivered to a family 2 or 3 weeks ago, a lady with 3 kids under 5, and for lunch they were having dry Jacob's cream crackers. It's not that there isn't enough food, there's plenty of food. It's just some of it's not in the right place, and there are a growing number of people who can't actually afford it.
The whole of Wiltshire Health and Care has responded amazingly to the COVID pandemic. You know, everyone has adapted the way that they work and completely changed the services that we provide. And yeah, I think sort of I can feel like there's a light at the end of the tunnel. You know, excited to go back to my other team and kind of get back to a bit more normality, really.
I qualified in 2019. So last year was my first year post-qualification. It's something I didn't think was going to ever happen when I just qualified. One of the patients I had, when I asked her, what do you think you will get from having this vaccine? And she said, oh, I'll be able to hug my grandkids because I haven't seen them for like a year. So it was really heartbreaking, but it was really good to see that, you know, she was looking forward to having that after having the vaccine.
I'm so glad I had my first vaccine. Thank to God, and thank to all the scientists and the doctors. Thank you ever so much. I'm so happy I had the first injection. Hooray!